This just in, acupuncture found effective for knee arthritis. www.healthcmi.com. Welcome. Today we cover some research showing that acupuncture is effective for the treatment of pain and range of motion issues in the knee caused by osteoarthritis. Published August 7th, 2019 at healthcmi.com. If you'd like to view it, simply go to the website healthcmi.com and click on News and look for the article entitled Acupuncture Found Effective for Knee Arthritis. The researchers from Dungjinman Hospital and Pushan Hospital together did joint research together on knee osteoarthritis. And what they found was that two sets of acupuncture points worked, and they compared the outcomes from both types. They did a rare special type of abdominal acupuncture, which is interesting, and compared it with local points to the knee, including inner and outer Xi'an, which is Nei Xi'an and Wai Xi'an, which are local points at the knee, and Heiding and other standard points. And what they found was that the abdominal acupuncture also worked quite well. So it was a kind of a surprising study with the results. It goes into complete details in the record there. But what is important as a takeaway is that acupuncture is getting results for people with knee osteoarthritis. Now, myself in my own clinic for 30 years, I've seen cases of knee osteoarthritis, and it tends to do really well with acupuncture for the most part. In fact, at healthcmi.com, there is also a plethora of articles showing that acupuncture can help with cartilage regeneration of the patella, of the knee. So there's a lot that can be done. There are definitely some options before people need to consider total knee replacement therapy or need to resign to a life of heavy medication, steroids, and painkillers. A lot of the points in the subpatellar space, patellar tendon, that region, are going to be things like Xi'an and Xisha, which is a very rare point. And we have a continuing education course for licensed acupuncturists called Acupuncture for Knee Pain, and that goes over the use of Xisha, which is below the patella. Most acupuncturists will treat Xi'an, which is what we call the eyes of the knee, below the patella, lateral and medial to it. But directly below there is also another one called Xisha, and that point is amazing. But also superior, very commonly treated by acupuncturists, is Heiding, and other local points, gallbladder 34, stomach 36, and the usual points that benefit muscles and tendons. There's a lot that can be done. There's a lot to consider. Acupuncturists can use manual stimulation. They can add moxibustion, which is a warm needle technique. Of course, electroacupuncture, wherein we can use a more gentle type of needling and let the current do the work. There's a lot of ways to go. What I find uniformly is, for the vast majority of cases, patients regain range of motion, but also have significantly less pain. So what's happening here is that acupuncture isn't just calming the inflammatory process of the nerve fiber. It's actually helping the tissue to repair. A lot of times there's problems with the meniscus, and even times when there's an ACL or MCL issue or an LCL issue. Now, ACL issues are particularly well suited to the acupuncture point Xisha if it's not the main point. And that 3-point combination was used by Grandmaster Wei Shui also. I should mention that. It's very important that he would do Xi'an left and right below the knee and then Xisha dead center. So they cross. Think of the 3 musketeers holding their swords up, one in the middle and 2 on either side tilted towards it. So they cross in the center. So technically, even though Xi'an is needled perpendicularly, because the skin is angled, each needle is pointed towards the center of the knee. And the center one goes straight in, and so they have a crossing deep below the tissue. That combination gets the job done. It's strong, it's effective, and it prevents the needs for heavy medications and sometimes surgery. Now, for the ACL, because it's located deep to Xisha, that point, it does very well. It's another story when you're dealing with the MCL and LCL, for example. In those cases, very gentle, very fine needles along the course obliquely of those regions often gets the job done, but it takes a little time. They tend to heal very slowly, but they do heal. Now, this is not the case where something has completely torn off. That will require surgery in many cases to sew it back on. Now, beforehand, yes, some acupuncture will have better outcomes with surgery, less chance of infection, less chance with adverse effects from surgery. And afterwards, definitely as part of the recovery program and the conditioning program, the acupuncture will come in very handy as well. So there's several other needling techniques that are appropriate for the knee, and there are many other types of knee problems that acupuncture addresses, including loss of cartilage below the patella and tracking issues. So there's a lot that can be done. It's very deep, it's very wide, and it's really worth exploring with your local licensed acupuncturist. Thank you for listening. www.healthcmi.com